Good afternoon and welcome to our Oak Bend Medical Center Happy Hour podcast. My name is Donna and I am your host. This month is Breast Cancer Awareness Month. So today we'll be discussing topics that may help you have a better understanding to make good decisions about your health care. To help us with that, we've invited Dr. Amber Dobyne. Dr. Dobyne is an OB-GYN and Oak Bend Medical Group physician. She has a strong compassion for providing care to underserved areas and is committed to delivering excellent care in women's health. Her special interests include adolescence gynecology, high-risk pregnancy, and contraception management. Welcome, Dr. Dobyne.
Oh, thank you for having me.
It's a pleasure. So we're going to talk about the thing that I think gives women a lot of anxiety is the possibility of having breast cancer. When should a woman start having breast exams?
So, as you know, October is Breast Cancer Awareness Month. So pretty much it's a national campaign that's used to promote awareness on breast exams and screening mammograms. So as far as your question of when to start breast exams, typically, a clinical breast exam is a breast exam that's performed by your OB-GYN or your other health provider, where they examine your breast for any abnormalities during a routine checkup. This is actually recommended every 1 to 3 years for women who are ages 25 to 39, and yearly for women who are ages 40 and up. There's also mammograms, which is an x-ray that's used to view tissue in your breast. Mammogram is used as a screening test to check for any abnormalities when you're not necessarily having any signs or symptoms of any breast disease. But if you find a lump or your healthcare provider finds any abnormalities on your exam, they can actually use mammogram as a diagnostic tool. Mammograms are recommended every 1 to 2 years, starting at the age of 40, and then yearly from ages 50 to 75.
Awesome. And then we talk about self-exams. When should young ladies and women start doing self-breast exams?
So pretty much when I counsel my patients, I promote self-breast awareness or self-breast exams typically from the start. When you examine your breast and get familiar with your body, you know if any abnormalities happen or any changes anytime before a health provider will. Most breast cancers are actually not found on mammogram per se, but for patients who have been doing self-breast exams and then are finding lumps or any abnormalities on their own. So it's definitely promoted that you do self-breast exams typically from the start early on to get familiar with your body so you can recognize any changes when they happen earlier.
Okay. And is breast cancer hereditary?
Contrary to belief, majority of breast cancers are not hereditary. These breast cancers normally arise in breast cells as they are acquired in a person's lifetime. Only about 5 to 10% of breast cancers are thought to be hereditary, meaning that these are cancers that are caused by a gene mutation that you inherit from one of your parents. The most common genes involved in breast cancer that are hereditary are the BRCA1 and BRCA2 genes. These genes are normally cause a more aggressive cancer and are associated with even other types of cancers like ovarian, pancreatic, gallbladder, and melanoma.
What are the signs and symptoms of a breast problem?
So some of the most commonly signs and symptoms of any type of breast issue, definitely first and foremost, if you identify any lump in your breast or in the axillary region or actually in your underarm or armpit area, if you notice any lump in that area, that's something that needs to be evaluated. Also, skin changes over the breast, meaning thickening of the skin, any redness of the skin over the breast, dimpling of the skin over the breast. This classically looks like an orange peel or the rind from an orange. If you see any dimpling like that, any pain in the nipple area or any retraction in the nipple area. Some women commonly have inverted nipples, but if you previously did not have inverted nipples and you notice some inversion of the nipple that you did not have previously, that is an area of concern. And then absolutely any type of nipple discharge other than actively lactating women with breast milk. Any green, yellow, bloody discharge is definitely something that needs to be evaluated.
I've heard of mammograms, and then I've heard of 3D mammograms. What's the difference?
So conventional, what you think about mammogram is a conventional digital mammogram or a 2D mammogram. It takes two pictures of your breast, one from above and then one from the side. A 3D mammogram takes actually multiple pictures from different angles and they form one 3D image. And this 3D image gives you a more detailed impression of the breast.
Okay. And Oak Bend has a 3D mammogram now, right?
Yes, ma'am.
All right. So I'm going to throw something out here. Large-breasted women, I've always heard, have a hard time doing regular mammograms. Is there something other than that large-breasted women need to do, or do they do mammograms as well?
It still is recommended for even women with larger breast size to still do mammogram. However, sometimes the mammogram may come back reported as inconclusive or an abundance of tissue, because pretty much they're looking at the ratio of your fibrous breast tissue compared to your fat ratio in breast. So if you have a larger breast size, you tend to have a more fibrous composition of breast tissue. So it may come back as reading a dense tissue on mammogram. In those situations, they may ask you to repeat images or either add more images or even add a breast ultrasound to try to rule out any abnormalities that way.
What happens if you see something abnormal on my mammogram? What are the next steps?
So mammograms are graded by the radiologist. Typically they come back as, negative, probably negative, unsure, maybe suspicious, or either highly suspicious. If something on your mammogram is seen as abnormal, it's definitely recommended that you follow up, which may include repeat imaging with, adding more views of the breast in different angles, and then also adding the breast ultrasound or possibly a targeted biopsy of any suspicious area they may see.
Okay. I've always heard people say, or doctors say, try to have your mammogram at the same place for consistency. Mm-hmm. Is that true?
Yes. For any radiology imaging modality, it is a more accurate comparison if you have old images that you can compare changes a long time. So if you have an abnormal mammogram, you've had, some spot that was suspicious on mammogram and you've got it done at the same facility, they can compare images from those previous visits and, see if there's changes in size, consistency, any, areas that look suspicious outside of what you previously had. So ideally, in a perfect world, you do want to kind of stick with the same facility so they can do the comparison. But again, a mammogram is better than no mammogram. So, you may have moved, changed areas, things like that. Insurance may change. You have different insurance coverages. So that should not inhibit you from getting a mammogram.
Is there anything preventative we can do for breast cancer?
So 1 in 8 women will actually develop breast cancer in their lifetime. That's the average risk for breast cancer. So there are some basic things that you could do to lower your overall risk for breast cancer. First and foremost, you want to maintain a healthy weight. Increased body weight and weight gain, specifically after menopause, has been linked to an increased risk of breast cancer, most likely due to the increased estrogen from the fat tissue that you have and also increased levels of insulin. Secondly, you want to exercise regularly and limit any sedentary behaviors, lying around, watching TV. We're all on our iPads and iPhones, just kind of sitting around. You want to limit that activity as much as possible. Thirdly, you want to maintain healthy eating habits, eating a variety of fruits, vegetables, whole grains, fiber-rich foods. And you also want to limit the amount of quote unquote bad foods like red meat, processed foods, or any sugary beverages. Um, Also, you want to limit your alcohol consumption. It has been proven that, alcohol has a link to breast cancer. More specifically, you want to limit to about one drink a day, meaning 12 ounces of beer, 5 ounces of wine, or 1.5 ounces of hard liquor. Also, limiting your exposure to hormone replacement therapy, especially in the menopausal people. This is the age range you mostly see the development of breast cancer for the most part, but it's been shown that combination hormone replacement therapy, meaning with estrogen and progesterone both, have been shown to have an increased risk. But coincidentally, if you stop your hormone replacement therapy, your risk will return back to the average risk after 3 years of stopping the hormones. And then lastly, breastfeeding is actually seen as protective. Even if you're breastfeeding for a few months, it has shown to just overall decrease your average risk for breast cancer.
Amazing. Is there something that you want our audience to hear about women's health? And not limited just to breast cancer, but to anything that you might want women to know, and even men.
Definitely promoting annual visits. A lot of times women of projective ages or even menopausal women, their OBGYN is the only provider they see. So it's kind of a one-shot thing to do a health maintenance on people who don't routinely go to the doctor very regularly. So, getting your annual exam, doing your clinical breast exam, your annual pap smear, even there's some routine lab work that we do, screening for sexually transmitted infections, yearly mammograms, even in the older population, bone density scans, colonoscopy screening, which is, very important. So we as OBGYNs do a lot of just routine health maintenance for overall just protective health for women, because sometimes we're the only provider that they see for a big substantial part of their lives. Schedule your annual visit, talk to your OBGYN, any problems you're having. We have tons of people in our referral system that if it's something that we can't handle, we can, get you to the right person that you need to. But at least, schedule your annual exam, be proactive in maintaining a good, health for yourself.
Dr. Dobyne is located at Williams Way Professional Building off the Southwest Freeway. And Dr. Dobyne, you're there every day, aren't you?
Yes, ma'am.
Okay.
We are here 8:30 to 5.
And we will be posting her phone number for you. Great OB-GYN, very compassionate with her patients, very dedicated to women's health. Dr. Dobyne, is there anything else you'd like to say in closing?
I think we touched on all the major points for this, but again, schedule your annual visit, schedule your yearly mammograms, and just everyone try to stay safe, especially in the setting of COVID these days. So you just do your part, we will do our part to make sure everybody's safe and well taken care of.
Wonderful advice. And I want to thank you, Dr. Dobyne, for joining us today. And a big thank you to our listeners for tuning in. Beginning now, set an intention and a relentless focus on living your life as the greatest person you can be in all situations. Please join us next week.
Thank you for joining us today on Oak Bend Medical Center Happy Hour podcast. We hope you enjoyed today's broadcast and invite you to email us at oakbendhappyhourpodcast@obmc.org with any questions or topics that you would like for us to cover. Remember, you can find us here each Friday at 5. Until next week, be mindful and stay healthy.